فرصة طيبة التقي بحضراتكم إن شاء الله بهذا البرزنتيشن. اليوم راح ناخذ سبجكت شوية كمان بالبراكتس صار بعد الإيرا أوف كوفيد وشوية صار عليه في conflict the role of hypertension, the pathogenesis of severe COVID cases or mortality, or the role of COVID in new cases of hypertension. We will cover the following subject in our presentation today. Does COVID-19 cases causes a new hypertension? Does hypertension is an important risk factor for severe diseases or increasing mortality? Does ACE inhibitors or angiotensin receptor blocker has a role in the pathogenesis of disease or increasing disease severity? Does the ACE inhibitors or ARBs superior to other antihypertensive in management of cases of hypertension with severe COVID? Does antihypertensive therapy affect the course of the illness? Does COVID vaccine has effect on hypertension? First, this was one of the first studies that revealed about the role of COVID-19 in new case of hypertension. It was in the early 2020. There is a rise in blood pressure observed among US adults during the COVID-19 pandemic. There was an increase in the systolic and diastolic blood pressure observed in the early 2020 among the cases of new COVID or the cases in the total population. The impact of COVID-19 was not clear because it involved all the societies, COVID cases or non-COVID cases. There are many explanations for that. Maybe the role of the COVID in generation of new cases of hypertension or increasing in the hypertension pre-existing, in case of pre-existing hypertension, or due to the limitation in access to medical personnel, so the patient of hypertension is not followed up very well, or due to stressful conditions, stress and anxiety. There is a big question mark about that. From this graph, you would see there is an increase in the systolic in the first one and the diastolic in the first one observed in early 2020 if compared with 2018 or 2019. Other study there that was hypertension in patient with coronavirus disease 2019, a pooled analysis also about March to May 2020. Hypertension, we found that hypertension is associated with approximately 2.5-fold higher risk of both increased severity and mortality. Then the guidelines from the SC pointed that every patient with hypertension should be kept on the same medicine, even ACE inhibitors or ARBs, because there was a little bit conflict about the role of ACE inhibitor in the pathogenesis of the disease, whether it's accelerate entrance of the virus, because we know the spike protein of the coronavirus use the ACE inhibitor too on the surface of the cells all over in the body, not even in the pneumocytes. Then another study, hypertension as independent risk factor for severity and mortality in patients with COVID-19, a retrospective study that found hypertension was an independent risk factor for the severity and mortality in patients with COVID-19. ACE ARBs inhibitors should not be discontinued in hypertensive patients with COVID-19. There's a question mark, another question mark. Other study later on, COVID-19 and arterial hypertension, hypothesis or evidence. The impact of hypertension on outcome and particularly on mortality in COVID-19 patients is not clear due to the lack of the data. Studies did not provide evidence that RAS inhibitors should be avoided or switched to another antihypertensive medicine. The risk of SARS-CoV-2 infection, COVID-19 progression, case of renin, angiotensin, aldosterone inhibitors, a systemic review revealed the following: there is no significant association between exposure to RAS inhibitors and susceptibility to COVID-19. So that's the end of all the conflict about ACE inhibitor in the management of COVID-19. Association that relate to improve the clinical outcome were rather seen suggested beneficial effect of its continued use among patients with clinical needs regardless of COVID-19. COVID-19 and hypertension, the what, the why, and the how. That's the study in the May 2021. The study pointed to the following, that that's one of the most important studies and one of the largest studies conducted between December 2019 and January 2020 in Wuhan, with data encompassing more than 1,000 patients has high blood pressure. The same study reported that 32.7 of hypertensive patients and higher disease severity compared with 13 of normotensive patients. بعدين صار عندنا يعني conflict بالموضوع in a cohort study of 1,000 more than 1,000 patients. Pre-existing hypertension was independent associated with COVID-19 infection. Finding of hypertensive patients have higher risk of developing more severe outcome. آخر استدي شوية تناولت هذا الموضوع شوية حلت لنا تقريبا الكونفليكت عن القضية. هاي الاستدي يعني وضحت لنا بوينت مهمة. The pre-existing diagnosis of hypertension per se was not an independent predictor of in-hospital death. In contrast, significant predictor of death beside older age, male sex, high level of C-reactive protein, heart failure, chronic kidney disease, the two latter condition are widely recognized as consequences of long-standing hypertension. The hypertension per se is not the risk factor actually. Treatment with first-line blood pressure lowering agent had a significant impact on mortality in patients with hypertension. That is, the use of any class of the first-line antihypertensive medicine are recommended according to guidelines and increase the probability of surviving severe COVID-19 cases. Another large observation suggests that low risk of worse COVID-19 outcome, hospitalized and death, or intubation in patients with hypertension treated with long period with ACE inhibitor or ARBs compared with those treated with calcium channel blockers. Yani, the end result from all these points that hypertension is not per se as an indicator of severity or lead to adverse outcome or causing increasing in mortality in severe cases of COVID-19 as pointed here. But the male sex, the atrial fibrillation, coronary artery disease, heart failure, CKD, stroke, COPD, all participate in the mortality. But the use of antihypertensive and insisting of controlling hypertension during the cases of severe COVID-19 has an impact on the survival. And the use of ACE inhibitors or ARBs should not only to be stopped, but should be continued. Okay. It should be continued because it's superior to other antihypertensive medicine. So, prognosis. Age, the worst prognosis point is age over 65, diabetes, coronary artery disease, heart failure, chronic kidney disease, atrial fibrillation, and increased C-reactive protein. And the good prognostic point by the end of all these studies is the age is lower than 65 years old. A treatment with high blood pressure lowering agent, and the final result that hypertension has no impact on in-hospital death. Finally, we have to take a little bit look about the role of vaccination and impact of vaccination on hypertension. We hear a lot of cases that after vaccination there is a surge in blood pressure. Yes, that was pointed in some studies. There is 2.5-fold increase in risk of admission in some cases vaccinated by Moderna or Pfizer vaccine lead to admitted to the hospital in some cases, and there is some cases reported to have a surge in blood pressure and reaching to the level of 200 and more than 200 systole and more than 100 diastole hours after vaccination. One case طبعا بالفايزر واكثر من case بالموديرنا vaccine, that one of the cases reached to the level of intracranial hemorrhage and lead to mortality. By the end of this study, there is a few points to take home. There is maybe an association between a new COVID-19 infection and increased blood pressure. There is a great conflict regarding association between hypertension and severe COVID-19. There is large studies are ongoing. ACE inhibitor use has no role in increasing severity of COVID, but may be associated with better outcome if used to treat hypertension in severe COVID cases. The treatment of hypertension with any antihypertensive medicine is associated with better outcome in cases treated for severe COVID-19 infection, or even in the cases treated in the mild to moderate COVID-19 treated at home. COVID vaccination may have an association with surge in blood pressure. Thank you.
Thank you, Doctor. This